Thank you very much for waiting. Now we'd like to open the lunch session where we can enjoy the lecture by Dai-ichi Insurance Company, how we can visualize the stress. Now I'd like to introduce the panelists during this lunch session. Innovation Department Head, Mr. Ryoichi Ichikawa from Dai-ichi Insurance Company. And we are honored to have Dr. Onishi, Principal CEO, and the professor of Shimane University. This session is moderated by manager of Dai-ichi Insurance Company, Rui Shuhama. Now, without any further ado, I'd like to ask Shuhama to take the lead for this lunch session. Thank you very much. Good afternoon, ladies and gentlemen, in this venue, and my greeting goes to the audience online. Now, during this lunch session, how insurance company can challenge the improvement of Mibyo by visualizing the disease. I'm a moderator for this session, Rui Shuhama from Dai-ichi Insurance Company. Though the time is limited, but please enjoy your lunchbox and please feel relaxed to see this presentation or panelist session. As you heard already, we are honored to have two distinguished panelists. The first person is Mr. Onishi. The other person is Dr. Onishi. These are the agenda items for today's lunch session. Now, at first, I'd like to ask Mr. Ichikawa to introduce who we are, Dai-ichi Insurance Company.
So, my name is Ichikawa from Innovation Department of Dai-ichi Life Insurance. So allow me to introduce you about our company. So this is the outline. So we are the first mutual company that has been founded in 1902, and we became a incorporated company, and we also became the TSE first division in 2010. So this is the 120th year since we were founded. And let me talk about the inauguration of our company. So Tsuneta Yano, who became the industrial doctor of Nihon Life Insurance. And so he understood that the mutual company is most important. So he went to Europe after quitting Nihon Seimei. So mutual company is you try to invest money, and those who have some calamities will be given the compensation, and the retained earnings will be given out to the investors. So then he first, in 1902, based on the understanding of the insurance company, he started the first mutual company in Japan. And that's why, because it was the first insurance company, this is the name of our company, Dai-ichi, which means the first. So the contractor is the number one, policyholder is number one, is his policy. And of more than 100 years, in 2000, the external environment changed. Low fertility rate, and people have Dink's family, and unmarried people increased, single people increased, and the insurance, the mortality insurance went down. And to secure the sustainability and towards a sustainable growth in the healthcare and the savings area, and also in the overseas, he drove the insurance company in 2012 to have a flexible management company. He became a stock-based company, and this is the current Dai-ichi Group's structure. So in Japan, there are 3 life insurance companies and 1 petty sum short-term insurance. And in Japan, in 8 areas globally, we have a stronghold. And Protective, when we acquired Protective, from 260 billion yen was sourced from the stock market. So from a mutual company, we became a stock company, and this was enabled only because we became a stock company. And not just life insurance, in order to improve people's health and QOL improvement. So to provide a new value, the group vision was renewed, all of one. Protect and improve the well-being of all. Beyond the framework of life insurance, we want to contribute to people's well-being is our philosophy. So protect and improve the well-being of all. This vision is shown to you through this video. So regarding the life insurance plan, based on the family makeup, we think about the asset building of in your retired age. So we have to think about college money, and I want our mothers and mothers-in-law to taken care of. So this is a plan that will cater to the changes of the family structure and for children's growth. So based on the authorization requirements, registration, your account is all complete. Yano-san, am I doing it okay? Am I doing it right? Yes, you are. It has been successfully registered. Thank you for your contract. So in the future, this application will bring a health advice, and all kinds of information useful to your life planning will be provided to you. This is awesome. So through the system, we will be connected and will support you. So regularly, we will contact you and communicate with you. And I will also take care of your mother. So this brings us a peace of mind. Thank you. So how am I doing today? So this is the bio data. The basic counts are okay, and the index regarding the diabetes is okay. So if you check my health every day, I become cautious. So there are some iron deficiency in terms of your nutrition. So okay, I will incorporate that in planning my lunch. Is everything okay? Your biometrics have shown some deviation. Increased heart rate has been reported. I suddenly felt dizzy and I fell to the ground. We recommend that you go to the hospital and get an examination just in case. I think I should be okay. I just need some rest. In this case, it is important to take necessary action early based on the past examples. Maybe you are right. Tomorrow morning, you will hear from the person in charge. Thank you. That's very helpful. Mother, are you okay? I feel fine now. Arrhythmia was detected, so I was hospitalized for examination and observation. You scared me, Mom. Miss Yano helped me with the hospital admission and other things. Other arrangements. So no worries, right? Thank you, Miss Yano. Based on what happened this time, I will revise the future plan. I'm also sharing some information regarding community support initiatives such as exercise clubs suitable for rehabilitation with your mother. Good for you, Mother. Thank you for all your help. Of course, to be right next to our customers throughout his or her life is our mission. They are so dependable. The future envisioned by health and cutting-edge technology will lead us to a future in which peace of mind is delivered throughout life and sympathize with the service recipient. Thank you for watching. So now you may have some idea of where we want to be. So in order to deliver this vision, we do this through a collaboration with the industry, government and private academia. So in order to address Mibio, we had this agreement with Kanagawa Prefecture, and Respo company has become certified as Mibio brand of Kanagawa Prefecture. So now three-way collaboration. So we use Biopirin and the early detection of mental disorder and improvement of Mibio in order to contribute to the improvement of people's well-being. So regarding this matter, Dr. Onishi would touch upon the Mibio. And that's all from me at Dai-ichi Seimei. Thank you for your kind attention. Thank you, Mr. Ichikawa. So we now give the floor to Dr. Onishi from Shimane Medical School. So what is a Biopirin? So based on his research, he will give us his presentation. The floor is yours, Dr. Onishi.
Thank you very much for the kind introduction. I'm Onishi from Shimane University. It's an honor for me to be with you today like this. Now, today, I'd like to talk about the urine biopirin that you heard in the previous session. I'd like to explain what urine biopirin is. Recently, so-called biosensing technologies have developed quite a lot. As you saw in the video, for example, wearable watch can tell you the the information, and then you can check your health state. And in addition to that, companies can provide many types of new services. And what's next? In my view, mental health and biosensing. This would be the next wave. Then why mental health? Why biosensing is necessary to check the mental state? Because stresses can cause many diseases. So stress is a trigger for many disorders. And however, there is a good stress. For example, stress may motivate you to work harder, but there are bad stresses that is the negative impact onto your body. Therefore, for the bad stresses, these are the triggers for many diseases and disorders, and therefore how we can sense them and control them. That is the issue for me. Then for employers, when I had discussions with the employers, they said that their employees have the mental health problems, and that is a burden for their companies. Many of them have talked about it because if mental health occurs for the employees, there's a lack of the human resources. In addition to that, medical cost to take care of those employees are really huge burden, and therefore taking care of the mental health for employees will be all the more important. Partly due to that, Ministry of Health is now obliging the stress check for the employers, and this was institutionalized in 2015, and then the application claim for the work-related insurance case has increased quite a lot, and therefore the new methods of checking the mental health will be important because of this backdrop. That's why for us, we try to focus on the mental health, and we try to use some biomarkers to see how good or how bad the mental state is. And at that time, we looked at the oxidant. Why? Because the activated oxidants have a negative impact onto the many organs, and this has been already known, and therefore we look at this because this can be a good sensing target. I am the expert in the cerebral surgery, and therefore solely for talking about the brain mainly, and there is the interneuron in the brain. For these cells, the activated oxidant has a very negative impact. One of the causes of the mental health is the relationships with the interneurons, and the interneurons may cause the mental health or psychiatric disorders, and therefore if I use the activated oxidants, if we can capture that in sensing, it would be good to prevent the potential mental health problems. However, there are many markers for the activated oxidants, and among them, we believe that biopirin and the urine will be really, very good. And then what does the product biopirin? Under the stress, the weak activated oxidant happens within the body, and then our body tries to prevent the negative impact from the activated oxidants, and therefore the neutralizing agent in our body is released, and at that time there is the substance so-called bilirubin, and this bilirubin protects us from the negative impact from the activated oxidants, and this bilirubin is regulated by the certain enzyme, and that is called biopyrin, and this biopyrin is good in some aspects. For example, there's no the reuptake and there's no reabsorption, and therefore the damage caused by the activated oxidants is very clear if we look at biopyrin, and therefore we use this as a biomarker. Biological mental health sensing will be possible in our view. Then, based on this hypothesis, if the stress level is very high, especially true to the patients with the psychiatric diseases, we made this trial, especially for the schizophrenia or the depressive patients have had a really high level of biopyrin. The other important finding is that the so-called ARMS, which can be medically defined for if the person is so-called at-risk mental state, then there is a high possibility of developing the actual psychiatric disorders. And when we measured the biopyrin, we found that there is a high level of the biopyrin for the ARMS people. And we have followed up the people with psychiatric disorders, and we found that when the stress level is high, and then they are approaching to the ARMS, we found that an increasing level of biopyrin, and when the schizophrenia is developed, and then the biopyrin peaks out, and after the remission of the depression, biopyrin level goes down. And therefore, I believe that the biopyrin can be the good stress marker, but in addition to that, monitoring marker can take biopyrin for the many psychiatric disorders. Furthermore, this is a report from the paper, and it says that due to the psychological stress, biopyrin level goes up. For example, the asthma and the cardiovascular diseases can increase the biopyrin level. In addition to that, downstream, some neural cells in the brain may be deteriorated, and that's why PD goes up. And it's reported that the biopyrin level has increased for the Parkinson's disease patients, and therefore biopyrin could be a very good stress markers, and therefore this is used for JAXA experiments. For example, in the closed space, the human being is closed to see how he or she felt stress. And one of the markers is actually biopyrin. Now, this biopyrin is a really good molecule. However, it's really hard to make this in the practice because there's a huge problem. That is that if you leave the urine at the room temperature, biopyrin is degraded immediately, and therefore we have to apply the cryopreservation, which is really laborsome. That's why biopyrin was not popular so far. However, if we have the preservant to prevent biopyrin from being degraded, it will be good. And actually, we have developed such a preservant, and that's why right now we can use biopyrin as a marker. Now, biopyrin based on the experiment or the checkup is now available, and we made the press release. And we have drawn quite a lot of people's attention, including mass media. Especially me, I basically work in Shimane Prefecture, and therefore many local papers in Shimane Prefecture featured my work. And I'd like to introduce the team members who developed the biopyrin. As I mentioned, I'm the brain surgeon, but the biomarker should get aligned with the actual psychiatric disorders, and therefore Dr. Horiuchi and Dr. Miyaoka, who are the experts in the psychiatric diseases, have collaborated with me. And then medically based marker, biopyrin would be really useful as a medically based marker. That's all for me.
Thank you, Dr. Onishi, for your splendid presentation. So at this point, the RESPO, where he works as a representative director, so the kit is launched, and it is based in Kawasaki, the Mibio research community. There's this collaborative research that was started with this association. So, Dr. Onishi, I give the floor to you to explain about this collaborative endeavor.
Thank you very much. So I'd like to introduce the demonstration study, which is closely related to the SDGs in our view. So please not remind that this is, let me remind me that this is related to SDGs. Now this is an overview of the research. Occupational stress survey, simple version, where you can measure the mental stress level. So this is the examination sheet or checkup sheet, and this sheet is used for the statutory stress checks. And in addition to this sheet, bioparin and the urine, how they are correlated, we try to elucidate the relationships between the sheet and the urine. Right now, we have the approval from the ethics committee, and then we can start the clinical study. And then more than 50 employees are here. For those companies have the target. However, the design of the study is very simple. So just filling out the survey sheet and the measurement of the urine, and then they are sent to the Shimane University for the analysis. Through this study, in the near future, we can identify the better care, especially the activated oxidants, which are released by the stress. What are the bad stresses are? We can identify bad stresses as a result of this study, and then based on that outcomes, we can create the checkups that would be contributing to prevent the employees' stress-caused diseases and disorders.
So this Mibio, you work together with the Mibio group of the Kanagawa and the collaborative research utilizing biopirin. So this biopirin urine test, the stress situation can be visualized, and let's say we can do that. And in the hospital, you can you're not diagnosed with a certain disease, so you visualize a Mibio using biopirin. So this Mibio situation because of stress, what kind of role does the insurance play? So what can health insurance do for this kind of situation? So Ichikawa-san, may I give the floor to you?
Sure, thank you very much. This is Ichikawa again. Now, insurance itself is just in case. For example, if you develop a certain disease, the insurance will be paid out for you based on the premium. However, just because of the coverage of the insurance, do you think everything is all right? Not necessarily, but you can get a peace of mind. However, when I consider the current social needs, if we keep the status quo as the business model, that's not sufficient. That's why I mentioned in my presentation, protect and improve the well-being of all. This vision is put forth by our company, and protect is more for insurance. It's just in case, just like an umbrella, and then improve. That is related to the Mibio improvement, I believe. Then for Dai-ichi Seimei, in addition to insurance business, key or lead was developed as a company based on the digital technology. Apart from the mainstay of the insurance business, the digital healthcare services are provided by this group company. This is a new business for us. And then I mentioned the word well-being. And I believe everyone has known this. That is the psychological and physiological and physical and social good state is well-being according to the definition of WHO. And therefore, when we consider our business scope, we have covered just the physical area alone, and therefore this psychological area or mental health area, we have to challenge this area in addition to the physical area. That's all for me.
Thank you for that, Dr. Onishi. So at the medical school, in a national medical school, so you have a collaborative research with a private company. That really doesn't happen often. So what do you expect from us? What kind of things is doable using health insurance? Please give us your aspirations.
Thank you. At the Shimane University, we'd like to collaborate with partner companies, but in my personal image, there are science school science people, and there's the literature-oriented people, but these two should be fused to create a new innovation, in my view. So we should not be dichotomic. So if you look at mental health, it's very true. As I mentioned, I'm the the brain surgeon, and therefore I have looked at only the physiological aspect. However, there's no medicine for brain, but medicine is only after developing the disease. However, if they under the mebile state and if we administer the drugs can be poisons, and therefore how we can care of the mebile state people, that is a problem. So it's true for the bioparin. For example, we have studied how we can reduce the level of bioparin. And now we found that one of the elements is improvement of sleep. After all, sleep is very important. And sleep is the important factor for the mental health. Other aspect I'd like to refer as another important aspect is the stress cause. Anxiety is the cause of the stress, and therefore we try to eliminate the anxiety because the drugs are not the panacea to eliminate the drugs. And then I happened to meet him, and I heard the insurance for the peace of mind. And therefore, if we can combine the drugs and the insurance, and then the mebile state mental health can be improved, meaning that people can enjoy the peace of mind, which may be the one form of treatment in the future. Therefore, in the future, if we study more and more, so-called insurtech, new type of insurtech may be developed from our collaborative research.
Thank you. So insurtech, thank you for mentioning that. Ichikawa-san, do you have any words on this?
Actually, my department is called Innovation Promotion Department, but the so-called InStech initiative was born for the first time here in Japan at our company, so I'd like to advertise it because Dai-ichi Seimei is the first company to do that. In addition to that, speaking of the PPA, the primary and secondary industries are really working at the PPA. However, for tertiary service industry, we were not so good at the PPA collaboration, in my view. So the public-private and academia collaboration should be promoted more, and there is a strong commitment actually.
Thank you. So we hope we can continue this discussion, but in the interest of time, we have to stop. So we will show you the outcomes of our research in the future. So how do we utilize data in the future is important. That kind of discussion was done yesterday. So the results of the research will be published in the form of a paper, and we will disseminate the information throughout the world, not just in Japan. So please kindly look forward to our results of the Dai-ichi Seimei endeavoring to give further research to mebile. Mr. Ichikawa and Dr. Onishi and Ms. Shuhama, thank you for your session. So we will now go on to the next session. We will now rearrange the stage. So please allow us some time.